Hello and welcome. My name is Natasha Sawicki and I am a Post-Op Coordinator in the Western Region. Today's webinar will be on FASD. What is FASD, you may ask? Well, it's a disorder that results from prenatal alcohol exposure. It first started off as FAS, Fetal Alcohol Syndrome. This is despite the pervasiveness of alcohol and drunkenness in human history. Fetal alcohol syndrome went largely unrecognized until 1973, when it was characterized as a tragic disorder by Jones and Smith, the two Seattle physicians who discovered it. But today, we now have it termed as fetal alcohol spectrum disorder. Most people have heard of FAS, which is fetal alcohol syndrome. FASD is a set of physical, behavioral, and cognitive disorders affecting people who were prenatally exposed to alcohol. They have a permanent disability that results in a lifetime of brain damage. FASDs are 100% preventable and the #1 known cause of intellectual disabilities. A baby born to a mother who drinks alcohol during pregnancy can have many problems. FASD include fetal alcohol syndrome. This is the most severe effect of drinking during pregnancy. It may include fetal death. Infants born with FAS have abnormalities of the face. They also have growth and central nervous system problems. This includes learning and mental disabilities. Parietal fetal alcohol syndrome, PFAS. This refers to children who have only two of the physical aspects of fetal alcohol syndrome. They have slow growth and CNS problems. There's also alcohol-related neurodevelopmental disorder. Children with ARND may have learning and behavioral problems. These may include problems with math, memory or attention, and impulse control or judgment. They may also do poorly in school. Alcohol-related birth defects. This can include defects in the heart, kidney, bones, or hearing. Now we will watch a short video of a child who has FASD and what his day is like for him.
It's really early in the morning. Mom and Dad are still asleep, but because of my FASD, my brain is always busy, and I'm already wide awake. Mom and Dad have made a planner for my day. I find it easier if I know what's happening and when. 8 o'clock means breakfast. Jam on toast is my favourite. I love the crunchy feeling of the burnt toast between my teeth. Mom and Dad know all about FASD. So does my auntie. She's having a baby. She isn't drinking any alcohol while pregnant, making sure my new cousin is as safe as possible. Doctors now know that it is not safe to drink alcohol at any time when pregnant. Mom says it's not always been that way. Lots of people still don't realise how dangerous alcohol can be to an unborn baby. Secondary school is a lot different to primary. Instead of one classroom, I've got 7 in one day. There are so many more people to get to know and things to remember. I hope everyone likes me. Sometimes it's too much at once. I feel much better now. Today I get to tell my class about FASD and why I think differently about the world around me. It's not just me, it could be as many as 1 in 20 people. It's more common than autism and ADHD. People need to think differently like I do. When people with FASD like me are supported by family, professionals and friends like you, then we can achieve great things. I like giving presentations and talking, though I'm not always so confident with maths. It sometimes helps to work things out in a different way. Thanks, Juliet. After school, I visit my friends at our FASD community group. We all have FASD, but we're each unique. Alfie and I love adventures. We like the way going high on the swing makes us feel all wizzy. Anna is very kind to animals. Sometimes she needs a reminder to be gentle. Alyssa is really musical. She loves the vibrations of the drum. Sometimes she plays too loud for me, but that's okay. I like dancing. After seeing my friends, I am starving. Hurry up, Dad. 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 I'm hungry. After a long day, I'm tired and my brain feels all fuzzy. But my family understands that my brain works differently. They know how to help me. I play my baby cousin a lullaby before bed. I can't wait to meet her. I have strengths and talents, and there is lots more to me than my FASD. But my FASD can often make life tricky, confusing, and frustrating when those around me don't understand why I think differently. When they think differently, life is much easier. My FASD makes me, me. It's really early in the morning. Mom and Dad are still asleep, but because of my FASD, my brain is always busy, and I'm already wide awake. Mom and Dad have made a planner for my day. I find it easier if I know what's happening and when. 8 o'clock means breakfast. Jam on toast is my favourite. I love the crunchy feeling of the burnt toast between my teeth. Mom and Dad know all about FASD. So does my auntie. She's having a baby. She isn't drinking any alcohol while pregnant, making sure my new cousin is as safe as possible. Doctors now know that it is not safe to drink alcohol at any time when pregnant. Mum says it's not always been that way. Lots of people still don't realise how dangerous alcohol can be to an unborn baby. Secondary school is a lot different to primary. Instead of one classroom, I've got 7 in one day. There are so many more people to get to know and things to remember. I hope everyone likes me. Sometimes it's too much at once. I feel much better now. Today I get to tell my class about FASD and why I think differently about the world around me. It's not just me, it could be as many as 1 in 20 people. It's more common than autism and ADHD. People need to think differently like I do. When people with FASD like me are supported by family, professionals and friends like you, then we can achieve great things. I like giving presentations and talking, though I'm not always so confident with maths. It sometimes helps to work things out in a different way. Thanks, Juliet. After school, I visit my friends at our FASD community group. We all have FASD, but we're each unique. Alfie and I love adventures. We like the way going high on the swing makes us feel all wizzy. Anna is very kind to animals. Sometimes she needs a reminder to be gentle. Alyssa is really musical. She loves the vibrations of the drum. Sometimes she plays too loud for me, but that's okay. I like dancing. After seeing my friends, I am starving. Hurry up, Dad. 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 I'm hungry. After a long day, I'm tired and my brain feels all fuzzy. But my family understands that my brain works differently. They know how to help me. I play my baby cousin a lullaby before bed. I can't wait to meet her. I have strengths and talents, and there is lots more to me than my FASD. But my FASD can often make life tricky, confusing, and frustrating when those around me don't understand why I think differently. When they think differently, life is much easier. My FASD makes me, me.
Prenatal consumption of alcohol results in irreversible structural damage to the developing brain. Most often, the damage is found in the frontal and central structures such as the hippocampus and the prefrontal cortex. This explains the fact that facial abnormalities are often evident, as the face is being developed at that same time as the brain structures behind the face. So what are some of the symptoms of FASD? Babies or children with FASD might have slow fetal growth and low birth weight. They may also have alcohol withdrawal symptoms in newborns such as high-pitched cry, jitteriness, and seizures. They may have sleep and sucking problems in infancy. Like I had mentioned before, the abnormalities of the face, shorter height than other children of the same age, poor physical coordination, hyperactivity, learning or thinking problems or a low IQ, speech or language delays, and problems with daily living, reasoning, and judgment. So why find out about the diagnosis? Because it can decrease anger, frustration for us all. It helps us to know negative behaviors are from a disability and not willful, and it helps to receive services early and get supports, and it also sets realistic expectations, decrease risk of secondary disabilities, and provide better self-acceptance and awareness, as well as increasing understanding that it is a lifetime disability based on brain damage. So most often, a healthcare provider can diagnose FASD based on the mother's history and how the baby looks. The healthcare provider will examine the baby to look for changes in the face, eyes, and upper lip. A newborn may show signs of alcohol withdrawal. These include shaking and a high-pitched cry. Older children may have learning tests. The provider will check for developmental problems. There is no single test to diagnose FASD. There is no current cure for FASD, but treatment is possible. Early intervention from birth to age 3 has been shown to improve the development of a child born with FASD. Because CNS damage, symptoms, secondary disabilities, and needs vary widely by individual, there is no one treatment type that works for everyone. So here are some of the possible complications of fetal alcohol spectrum disorder. They can range from mild learning disabilities to more severe behavioral and mental problems. There might also be physical disabilities or birth defects in children with FASD, and these do not get better. Some long-term problems might also include mental health problems. They may have poor social skills, whether it be on the job or at school or at home. They might also not be able to get a job or keep employment. And they might not also be able to finish school, as it can be very hard for them with all the different things that happen around, whether it be loud noises, lots of things to remember. It can be hard for them to just kind of wean in on one thing and follow along and learn. An afflicted child faces a lot of secondary disabilities when he or she grows up. Here are some of the common complications that adults with fetal alcohol syndrome face on the daily. They may have mental health problems. Apart from causing mental handicaps, fetal alcohol syndrome also comes with certain brain anomalies. These problems can lead to developmental and psychiatric disorders in adults afflicted with the sad disease. They may also have attention deficit hyperactivity disorder. ADHD is defined as a pattern of behaviors marked by impulsivity, hyperactivity, and severe inattention. They themselves might have chemical dependency issues and abuse. Impairments seen in people with FAS make them more likely to engage in high-risk behaviors such as alcohol or drug addiction. For one, they are already biologically vulnerable to the substance, and people with fetal alcohol syndrome also have a tendency to self-medicate, which increases their tendency to use painkillers. Lastly, alcohol effects on the brain have given them little to no impulse control. With these factors combined, there is no surprise that people with fetal alcohol syndrome have a higher tendency to abuse alcohol or drugs. The high figures are also seen in other studies. According to Grant et al., 60% of women with FASD who are confined to treatment abuse alcohol, which as much as 79% took illegal drugs. Another complication can be inappropriate sexual behaviors. Sexual misconduct is common in people with fetal alcohol syndrome due to the impairments brought about by the condition. These individuals are inherently impulsive and lack inhibition. Additionally, they have poor memory and planning. With these dysfunctions, a lot of people engage in inappropriate sexual behaviors, with most of them going to jail due to such infractions. They may also have educational problems. Concentration difficulties and trouble adapting to change are just some of the problems encountered by people with fetal alcohol syndrome. Because of these changes, they might find it hard to finish school if they can stay enrolled at all. They may also have employment problems. These employment difficulties may be due to the lack of focus and understanding, just some of the hallmark effects of fetal alcohol syndrome. And last, they may have troubles with the law. Because of the brain damage brought by fetal alcohol syndrome, people with this said disorder are at higher risk of being involved in the legal system, whether as the victim or the offender. Now I'm going to talk just a little bit more about some of the challenges of FASD. So they may have impulse control, which we've talked a little bit about. It can impact anger response. They may take things, their sexual choices, swearing, or having verbal aggression. They may also have sensory issues, can be sensitive to bright lights, can struggle with textures of foods, or even just be a fussy eater. Flight or flight response, not wanting to be touched, sometimes can hear very light humming or buzzing sound, and odors can have a huge impact leading to explosions. They may also generalize. They struggle to transfer skills to different situations with different people, places. They may also have some memory struggles, short-term versus long-term memory. Short-term is what is called our working memory, and with FASD there is almost always a deficit in the working memory. They may also have anxiety. Their heart rate can increase, body temperature can rise, and all this is tied to brain function. It may also have some sleep challenges. Sleep is directly linked to brain function. It's important to understand this and not get upset with or impatient with a person or child if they are not sleeping well. Some additional challenges can also be difficulty with abstract concepts, inability to manage money, difficulty telling time, patterns of lying, poor problem solving, being stubborn or perseveration, and they can struggle with delayed gratification. So FASD can be prevalent among adopted children and is most often diagnosed. Children with FASD struggle with impulsivity, focus, attention, and deficiencies in executive functioning, among other behavioral challenges. Commonly, psychologists and psychiatrists assign various mental health labels to individuals with FASD and miss the signs of brain damage. Some of the disorders that they may misdiagnose could include autism, antisocial personality, bipolar, reactive attachment disorder, among some others. There are a bunch of things that can be tough for a child or a parent of a child with FASD. But let's take a look at some of the positive things. They have many strengths that include they can be very highly verbal, energetic and hardworking, caring, kind, and loyal, curious and involved. They're very friendly and likable, talkative. They have a strong desire to be liked. They don't hold a grudge. They're good with younger children. They're not malicious. And to them, every day is a new day. Here are a few strategies that can make life easier for all involved with FASD. So some strategies to always remember. Remember it's brain damage. Be patient and give grace. You may have to change the environment. Don't always ask why. Don't match fire with fire. And forgive and forget and move on. Using these strategies will definitely help make your life, as well as the child's life, much easier. The single most effective intervention is to help the family get support and education so they can better understand their child's disability. Newborns may need special care in the Newborn Intensive Care Unit, or NICU. A newborn may get medicine to help with alcohol withdrawal. The physical problems seen in FASDs last throughout life, but programs can help improve a child's development. Such programs may focus on improving a child's behavior with early education and tutoring. Programs also help parents with parenting skills. Medicine may help a child's attention problems or hyperactive behaviors. Over time, your child may get help from special education programs and social services. So how can I help my child live with FASD? The first thing is to know that FASD is a lifelong disorder. Most states have early intervention programs. Public school systems can also offer support to children with FASD, and this will help them be successful in school. There are also state and local social services that can help families with special education and services. Studies have shown that getting help early is the best. And children with FASDs also are helped by being in a loving, nurturing, and stable home. So let's reframe this. Let's move away from consequences, which produce anxiety in children with FASD. A child is more likely to learn a skill when they are not anxious or angry or being pushed to do something. We often hear people say, "Why don't you do this?" When in turn, you actually need to say, "Why can't he do this?" And try to figure out a way that would be helpful to help them be successful in their everyday life. You also need to be specific. Don't say, "Take your feet off the table." Say, "Put your feet on the floor, please." It might also be helpful to reframe things by using visuals, including timers, or other ways that help your child understand when it's time to move from one thing to the next. Next, let's talk about home life. Some ways and things that can help regulate your child at home. So supervision is important. It's always important to make sure you know where your child is and to have things in the home safe. Try to declutter as much as possible. Having too many things in front of them or in an area can be overwhelming. Try to be patient. You may have to reteach things over and over until they catch on. And sometimes you might have to change your expectations. You need to try to keep it simple. No multi-step directions. Too many steps can make them confused. You might have to try to resolve sleep issues as much as possible. Try to keep consistent sleep routines. Or anything that you've noticed has helped in the past, continue doing it. Also remember, they may use a wrong word when it comes to a feeling. So it might not make sense to you, but just kind of think about what it might be that they're trying to relate to you. Expect inconsistency and celebrate it when you're wrong. Don't focus on stopping a behavior. Focus on calming the arousal. And don't point out consequences, perceived as a threat when your child is in the red zone. I wanted to also add some books that I found about fetal alcohol spectrum disorder. Some of the books I found that I think would be helpful include Try Being Different Rather Than Harder, Damaged Angels, The Best I Can Be, When Rain Hurts, Fetal Alcohol Spectrum, A Guide for Families and Communities, and The Braided Cord. Next, I just wanted to talk a little bit about some statistics we have here in North Dakota. So, child and adult populations of people with fetal alcohol syndrome disorder in North Dakota could be as high as 1,224. An annual cost of medical care services is around $5,000 per case of FASD. The annual excess cost for medical care due to FASD is around $4,000 per case. In North Dakota, the cost of inpatient medical care for each case of FASD to the age of 18 is around $95,000. It could cost parents around $17,000 per year to care for a child with FASD due to some of the special needs they may have. Identified costs for each person with FASD in North Dakota are at least $2 million per year. The minimum cost estimate for the state of North Dakota to age 18 for each case is around $118,000. If women who have a child with FASD continue to drink, they have more than a 75% chance of having another child with FASD. Another point to put is that at the Center for UND, which is in Grand Forks, there's a gentleman named Larry Bird, and he works for the Fetal Alcohol Syndrome Center, and he's the director there, and his research encompasses areas such as fetal alcohol syndrome, autism, sudden infant death syndrome, and many more. I want to thank you for coming and attending my webinar today. I hope this information gave you a little bit more knowledge on FASD. If you have any questions, feel free to reach out by calling or texting me at 701-371-5373 or send me an email at the address listed. Thank you and have a great day.